It's Monday, February 14th, 2011. In this week's BeakerBeat, a multi-billion-dollar deal becomes the perfect Valentine's Day gift for one company's shareholders. Find out who sweet-talked who in this merger. Plus, another drug maker giving death row inmates some love. It's a St. Valentine's Day massacre in reverse. We'll explain.
Yes! 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 Oh! Oh! Oh!
And it could be titled Mission Impossible. A new film reveals the pharma industry's quest to give women an orgasm. Could a pink Viagra work, or would old-fashioned methods be better? All that and more in this week's edition of BeakerBeat. Hello everyone, welcome to this week's edition of BeakerBeat. I'm Mike Justice, thanks for tuning in. It is Valentine's Day, so if you forgot to give your significant other flowers or chocolates or that sort of thing, you still have a little bit of time. We came out here to this arboretum to look for some flowers, but of course everything's dead. Fortunately, I did remember to bring the chocolates. Now, as far as our top story goes this week, there was a big merger, but not the one you're thinking. Our top story involves a multi-billion-dollar buyout, but it doesn't involve Sanofi-Aventis or Genzyme. Microscope manufacturer Danaher has agreed to buy Beckman Coulter, a maker of diagnostic systems, for $6.8 billion. That comes out to $83.50 a share and includes about $1 billion in debt. Danaher CEO Lawrence Culp said the aging population prompted the company to acquire Beckman. It will become part of Danaher's life sciences and diagnostics business if the deal goes through. That would more than double the life science unit's revenue, making it Danaher's largest business. Now, Beckman Coulter is based in Brea, California, and makes products that simplify and automate biomedical testing. The company had reportedly put itself up for sale back in December. The $83.50 per share price is a 45% premium over Beckman's share price on December 9th, the day before the acquisition rumors first surfaced. Danaher, which is based in Washington, D.C., reported $13.2 billion in revenue in 2010, with $2.3 billion from the life sciences business. It also makes Craftsman tools for the retailer Sears. Now, Beckman Coulter has not reported its full-year results yet, but it had $2.68 billion in revenue in the first 9 months of the year. The deal is expected to be completed in the first half of the year. So tell us what you think about this story or any story that you see here in today's show. It's very simple. Click on the orange button below me. Box will pop up. Type in your comments, send it to me. I promise I'll read and respond to every one of them. And now I think I'm going to actually try one of these chocolates.
The land of chocolate.
And when you're done watching BeakerBeat, check out Beaker's blog and find out what UK leaders are doing to retain the talent that will soon be out of work following Pfizer's announcement of the closure of its leading R&D facility there. Plus, has DTC advertising gone too far? A look at the ever-stretching boundaries in search of new customers. Those stories and more on Beaker's blog.
My mom always said life was like a box of chocolates.
So Forrest Gump famously said, life is like a box of chocolates. You never know what you're going to get. I got to try one of these before I give it away. Tastes like pork. Sanofi-Aventis and Genzyme continue to talk about a takeover deal, and industry insiders have been signaling it's coming at any time, yet still nothing but crickets. The only movement has been Genzyme finally agreed to let Sanofi check its books. Several news services are reporting Sanofi will pay a $74 per share price for the big biotech, with a contingent value right security that could range from $2 to $6, depending on the market success of the MS drug Lemtrada. It seems Sanofi CEO Chris Viehbacher, following a 6-month standoff, plans to take his sweet time examining Genzyme's books before finalizing a deal. Genzyme is in 80 markets and has 14 manufacturing facilities, so getting through due diligence takes time. The latest deadline of February 15th will likely be extended. Now we all wait to see if what's in those books will seal or kill this deal.
Should we punish this man for crimes he did not commit? No, 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 no.
That you speed things up.
Okay.
Such a man should be set free.
Yet another drug maker has lodged a protest against capital punishment. Novartis, whose generics unit Sandoz makes a copycat version of sodium thiopental, says it is forbidding its distributors from channeling the drug into the U.S., where it might be used to execute death row prisoners. Meanwhile, 13 U.S. states are having so much difficulty getting the drugs they need for executions, they've asked the feds to step in and help. This is just the latest in an ongoing tug-of-war over products that are part of lethal injection drug cocktails, but are much more commonly used in hospitals. Hospira decided to stop making thiopental entirely. It had planned to move thiopental manufacturing to an Italian plant, but government officials there threatened action if Hospira didn't block its use in executions. So the easy way out, Hospira pulled the plug on thiopental. The FDA, meanwhile, has bent over backwards to stay out of the execution drug mess. It even issued a statement to that effect, saying that it wouldn't punish states for importing drugs that aren't agency approved, and that it wouldn't vouch for their safety or efficacy either, basically washing its hands of the whole thing. But that didn't work. The agency now faces a lawsuit filed on behalf of 6 death row inmates in 3 states that claim the FDA violated federal law by letting states import the meds without considering their safety. To that I say, really? Your safety? You're on death row. Time for some quick hits now, and a merger is the kind of gift that keeps on giving. Headaches, that is. They also say that too much chocolate gives you a headache. I think I'm going to test that theory out. Just one more piece. After inheriting a contaminated former chemical plant from its merger with Wyeth, Pfizer is working with the EPA on a potential 9-year cleanup effort to make the site usable again. The company is already pumping at least 650,000 gallons of groundwater from the site on a daily basis. Good times. But wait, that's not all. Bloomberg is reporting that Pfizer has agreed to settle lawsuits over its menopause drug Prempro for $330 million. Pfizer inherited 2,200 lawsuits claiming that Prempro caused breast cancer when it acquired, guess who, Wyeth in 2009. Each case will settle for an average of $150,000. Interestingly, or disturbingly, depending on how you look at it, Prempro is still on the market. The Department of Justice and HHS are revealing more details about the extent of their efforts to combat healthcare fraud, telling Congress they now have more than 3,000 open criminal investigations. While many of those cases apply only to individuals, drug makers are also under scrutiny. Turns out there are now more than 180 whistleblower cases under investigation that allege fraud in connection with the pricing and marketing of pharmaceuticals. There's a laundry list of job cuts to pass along. After a devastating blow dealt by the FDA, Mankind cut 179 workers, or 41% of its workforce, as it focuses all its energy and resources on its troubled inhaled insulin program, Afrezza. Johnson & Johnson's Cordis Medical Devices unit will lay off an unspecified number of salespeople and merge 2 separate sales forces within the division. Sales have fallen sharply due to falling demand for its Cypher heart stent. Orexigen has eliminated 40% of its workforce a week after the FDA shot down its application to start selling its first product, a new drug for obesity. And finally, device maker C.R. Bard is cutting 200 manufacturing jobs at its Queensbury, New York plant. The FDA is looking to farm out more inspections of foreign plants as it aims to expand oversight in the rapidly growing world of overseas manufacturing. Bloomberg reports the FDA has been inspecting foreign plants every 9 years on average, compared with every 30 months in the U.S. The agency knows it must improve on that and has actually been told as much. Congress busted the agency's chops for this lag in foreign inspections and upped funding for their expansion. Foreign manufacturing continues to grow thanks in a big way to outsourcing by Big Pharma, so the FDA won't just need to catch up on back inspections, but must somehow oversee all the new plants popping up around the world. Checking money matters, and if you're wondering why Sanofi Aventis is so hot for Genzyme, look no further than its 4th quarter financials. Sanofi saw net 4th quarter profits drop by 64% year over year to about $596 million. A huge restructuring charge and lack of flu pandemic dragged the numbers down, but it's the pharma sales numbers that really tell the tale. They came in at $8.9 billion, a bit higher, but when adjusted for currency effects, they dropped 2.7%. New generic competition for the blood thinner Lovenix and cancer treatment Taxotere, plus European copycats for top-selling clotbuster Plavix are to blame. Plavix will get U.S. rivals in May of 2012. CEO Chris Viehbacher sees more of the same this year, and he predicts a 5 to 10% drop in earnings for 2011. Having harder to copy rare disease meds, such as Genzymes, could help. Anacor Pharma has entered a potential $160 million deal with Medicis Pharma to develop a boron-based acne treatment. The deal includes a $7 million upfront payment and up to $153 million in milestone payments. Anacor is responsible for the early development and research. Shire's product sales broke the $3 billion mark for the first time. The drug maker benefited from the manufacturing problems at U.S. rival Genzyme and increased sales of its hyperactivity med.
Oh. Oh, God. Oh, you're right there. Oh. Oh. Oh, God. Oh, yes. 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 Yes.
You ever stop to wonder why men buy women flowers and candy? I mean, it's to make them happy, of course, but the end goal is for both parties involved to have a happy ending. For men, that's easy enough. But for women, it can be much more difficult. Enter the pharma industry and a new documentary that covers their quest to give women an orgasm. I'm not making this up. Orgasm Inc. opened in limited release this past weekend, and it focuses on the race by drug companies to find a cure to what's been coined FSD, or female sexual dysfunction. So if you're a female, chances are you are suffering from this, even if you didn't know it. Because unless you are having an orgasm with every proverbial roll in the hay, you fall under their classification of a potential patient. Some of the wacky elements in the film include a middle-aged woman named Charletta who goes under the knife to have an orgasmatron, seriously, that's what it's called, implanted near her spinal cord. The remote control orgasmatron, I just love saying it, an experimental electrode, is a real trademark device that takes its name from a fictional contraption in Woody Allen's 1973 film, Sleeper. But the device doesn't deliver toe-curling orgasms, instead simply stimulates her left knee reflex, which sounds about the same amount of success a normal man would have. The film was made by Liz Canner, who was drawn into this world when she was hired a decade ago by drug maker Vivus to edit erotic video used in clinical trials of an orgasm cream for women. Several companies were looking for a pink Viagra, and she decided to start interviewing people involved in this effort. The documentary suggests that not only are pharma companies trying to sell a drug, they're trying to sell a disorder. A Vivus exec says in the film, quote, "For us to develop drugs, we need to better and more clearly define what the disease is," end quote. Canner goes on to detail articles and meetings that back up this assertion, including an interesting revelation that the outspoken Dr. Laura of radio fame was paid handsomely, sometimes $75,000 a day, to preach the gospel of FSD. When asked about her portrayal in Orgasm Inc., Dr. Laura downplayed any conflicts of interest, saying she sees the pharma companies as an ally. I would too, at that pay scale. Orgasm Inc. challenges the over-medicalization of female sex drives, suggesting that education is the real answer. For example, did you know that the majority of women don't climax with intercourse alone? Who knew, Jeremy? Now, of course, we here at Beaker do believe that many drugs out on the market save thousands of lives every day. But as far as a pink Viagra goes, maybe we should go back to the old standard bearer of flowers and chocolate. Just saying. That's it for this week's edition of BeakerBeat. I'm Mike Justice. Thanks for watching. We'll see you next week. And now I gotta go to the store and buy more chocolate. It's so good, Jeremy. Sit, Beaker. Sit. Good dog.